Hi all. Good morning everyone. Hi Ajisa. Hi Fizzy. Hi Neetu mom, how are you? Okay, so let's start. നമുക്ക് എല്ലാവർക്കും അറിയാവുന്നത് പോലെ നിങ്ങൾ നമ്മുടെ പോസ്റ്റുകളിലൊക്കെ കണ്ടു കാണും. ഇറ്റ് ഈസ് എ ബിഗ് ചാൻസ് ഓർ ഗോൾഡൻ ചാൻസ് ഫോർ ഓൾ നഴ്സസ്. There is a big nurses recruitment drive is going on all around the Kerala. There will be a direct client interview on 14th and 15th at Kochi. And there will be one more interview going on the 9th. That's going to be the first one on 9th of November. There will be one in Palakkad, and it is a direct interview from the delegates from UK. So it is a golden chance for all nurses. And at Kochi it will be on 14th and 15th. So make use of this opportunity. നമുക്കറിയാം ഒത്തിരി നഴ്സസ് OET പാസ്സായിട്ട് അല്ലെങ്കിൽ IELTS പാസ്സായിട്ട് ഏത് ഏജൻസിനെ അപ്രോച്ച് ചെയ്യണം, പ്രോപ്പർ പ്രോസസ്സിങ് നടക്കാൻ, ഡയറക്റ്റ് ഇൻ്റർവ്യൂവിന് ചാൻസസ് ഉണ്ടോ, അങ്ങനെയൊക്കെ എൻക്വയറി ചെയ്തുകൊണ്ടിരിക്കുന്ന ഒരു സമയമായിരിക്കും. സോ യു മേക്ക് യൂസ് ഓഫ് ദിസ് ബിഗ് ഓപ്പർച്യൂണിറ്റി. It is a big recruitment drive and it is conducted by direct management from the UK. So if you have a chance, കാലിക്കറ്റിൽ കൊച്ചിയിൽ ഒക്കെ ഉണ്ട്, നിങ്ങൾക്ക് സൗകര്യമുള്ള സ്ഥലം എവിടെയാണെന്ന് വെച്ചാൽ അവിടെ പോയി ഇൻ്റർവ്യൂ അറ്റൻഡ് ചെയ്യുക. എത്രയും പെട്ടെന്ന് വിത്തിൻ 3 months 4 months ഒക്കെയാണ് അവർ പറയണത്. എല്ലാം റെഡി ആണെങ്കിൽ പോകാനുള്ള സമയം. നമുക്ക് ഇൻ്റർവ്യൂ അറ്റൻഡ് ചെയ്യുന്നതിന് OET IELTS ഒന്നും നിർബന്ധമില്ല. 6 months വാലിഡിറ്റി ഉള്ള നമുക്ക് DL കിട്ടും. എന്നിട്ട് അതിൻ്റെ ഉള്ളിൽ നമ്മൾ എഴുതിയെടുക്കുകയാണ്, അല്ലെങ്കിൽ എഴുതി റിസൾട്ട് വെയിറ്റ് ചെയ്യണവരാണ്, ഈ അടുത്ത് എഴുതാൻ പ്ലാൻ ചെയ്യണവരൊക്കെ ആണെങ്കിൽ സുഖമായിട്ട് നമുക്ക് ആ ഇൻ്റർവ്യൂ അറ്റൻഡ് ചെയ്യാവുന്നേ ഉള്ളൂ. നമുക്കൊരു ഓഫർ ലെറ്റർ ഉണ്ടെങ്കിൽ ഇറ്റ്സ് ഗോയിങ് ടു ബി ഇറ്റ് വിൽ ഗിവ് അസ് സം മോർ പോസിറ്റീവ് എനർജി അല്ലേ. ആ ഒരു എയിമിന് വേണ്ടി വർക്ക് ചെയ്യാൻ കുറച്ചുകൂടി ഒരു ഇൻട്രസ്റ്റ് ഉണ്ടാവും. സോ ഇഫ് യു വാണ്ട് ഗോ ഫോർ ദാറ്റ് ഇൻ്റർവ്യൂ ആൻഡ് try to achieve your dream as soon as possible. Okay, so today we are focusing on an urgent letter. As we all know, we have 3 different types of letters in OET, especially for nurses and doctors. There are 3 types of different letters, and they are referral letter, discharge letter and transfer letter. These are the 3 different types of letters for nurses. In referral letter or in transfer letter, it's going to be there may be one letter is going to be an urgent letter. It may be an urgent letter. Sometimes we see urgent referral or urgent transfer. In this situation, the writing method is going to be different. We know how to write referral letter, we know how to write transfer letter, and we know to deal with the discharge letter. When it becomes an urgent letter, when it is an urgent matter, we sometimes may be confused about how to manage that letter. So today we are focusing on such an emergency letter, and this is the case note, and we will be pinning the case note in the comment box. If you want, you can go through it later on. Okay, for all types of letters, the organization, the basic concept of organization is going to be the same. There are two types of organization for each types of letters. They are thematic organization and chronological organization. So what OET recommends is you can organize any letter in that way. You can organize it in a thematic way, or you can organize it in a chronological way. So in that, when it comes to an urgent letter, it is going to be different again. So how to approach such an situation, that's what we are going to look today. In an urgent letter, the organization is going to be thematic organization. When we say about thematic organization, the main issue has to come in the first paragraph, then the secondary issue can go to the second paragraph. So it is our responsibility to decide what comes under the main issue. When it is an urgent letter, we all know that it is an urgent situation and that doctor is going to deal with this emergency. So his important area is to understand what's wrong with the patient. Is she all right? Is she about to die, or is she needs an urgent care at this second? So that is the main issue for the reader. So we should include the present history or patient's today's condition in the first paragraph. When I say first paragraph, it is after the introduction. That is the difference when we write an urgent letter. Okay, and it is sometimes we don't take note of that point. When we see some case note, we may be thinking, okay, without telling the story, we can't go to patient's today's condition. So it is better to write the past history or the medical background or the social history before the present situation. Then that's going to be wrong, because OET strongly recommend to write the present situation or today's situation in the first paragraph, even though there is a story that leads to her or his present condition, that can be written as the second paragraph, because that's going to be secondary issue. Patient's today's condition is the main issue. So that's the way we need to, when we organize an urgent letter, that is the way that we need to remember all the time. Okay, so with all these things in our mind, we can move to the case note. This is the case note, Miss Patricia's child's case note. It is from the our OET official website, and this case note, whenever we see a case note, we go to the task first, because just it is important to understand who is our reader, why are we writing this letter, and is there any existing relationship between the patient and the reader. These are the things to look first. To know that, we need to go to the writing task first, and we have 5 minutes reading time. So we do all these things in that 5 minutes reading time. What I do first is go to the writing task, then go through the case note with 1 or 2 minutes, just to get a picture of what's going on. Then we need to go through the case note again. Okay, so when you do that for the second time, you need to select the relevant information to be included in the letter. Okay, so I'm not going to do the first reading now. I'm just going to do the second reading. I have gone through the case note once in that first 5 minutes, so it might take not 2 minutes. After that, now I know what's going on here. With all these things in mind, with the reader in mind, with the purpose in our mind, I'm going to go through the case note again. Okay, so the writing task here is using the information in the case note, write a letter of referral. So we know that it is a referral letter to the emergency department consultant on duty. So we know that when we say consultant, we know that it is going to be a doctor. Then in most of the OET writing tasks, the purpose will be given there. So the purpose is going to be outlining the case note and requesting urgent assessment and management for pericarditis. So the request is urgent assessment and management, and take note of this urgent, because we don't need to assume whether it is an urgent letter or a usual situation. It will be clearly given in the case note. Okay, so that's what OET says. We don't need to assume is it an emergency situation or not. For that, OEC recommends 3 verbs to look for. They are urgent, immediate, and emergency. If any of these 3 words are there in the request or writing task, or just above the writing task, we can assume that it is an urgent letter. We can know that it is an urgent letter. We don't need to assume the urgency of the letter. So there won't be such a confusion on the exam day. It will be clearly given in the writing task or just above the writing task. Here it is given clearly in the writing task itself. Okay, and address the letter to the emergency department consultant on duty, Newtown Hospital, 100 Main Street, Newtown. So the address is clearly given there. Now I move to the starting of the letter. So as I mentioned, this is the second time I am reading the letter. For in the first time I just went through the letter and I know what's going on. This time when I go through the letter again, I am going to put a tick mark for relevant information, and I am going to put a cross mark when it is a totally irrelevant information, and I am going to put a query mark if it is a semi-relevant information. That's the way we need to read the case note for the second time. When we know the reader, when we know the purpose, and when we know what's going on for this patient, we with our experience and with our medical knowledge and everything, we will be able to select the relevant information according to the reader or according to the purpose. Okay, so I'm going to start from the beginning. You are a nurse conducting a nurse home visit. So I am visiting this patient at his home of routine follow-up care after this patient's recent hospital discharge. Okay, that's why I am visiting. He had some hospitalization, and after that home visits were arranged, and I am visiting this patient at his home, and I might include that information in my letter. Okay, and patient's name we definitely need that, and date of birth we definitely need that. When there is a date of birth and age in the writing task, in the reference line it is better to include the DOB instead of age. It is better to include the date of birth of the patient. That is more formal. You can include age there if you need, but including date of birth is more formal way of writing, and again you may include the age in the intro paragraph. Okay, so I'm moving to social background. She is a retired primary school teacher, lives on her own, husband died 3 years ago. Okay, so she is no children, she is on her own, and she is a retired teacher. I might need to include one sentence including all of things. I might include one sentence about her social situation there. Okay, it all depends on the way I make sentences or transform case notes. Then I move to medical history. She has a history of hypertension, diagnosed in and mild in 2013, moderate 168 1 common skinable, regular monitoring, currently well managed at around 140/90. So I need to include the information that she is hypertensive and her normal BP is 140/90. Okay, diabetes mellitus, that's an important information as well. So I need need to include that information. Depression, I need to include that information, and there is medicines there as well, and the year of diagnosis. I will see how I'm going to organize the letter in a minute, then I will decide what to include this letter. Okay. Then I move to family medical history, mother, hypertension, diabetes, mellitus. It is an emergency situation and I am writing to the doctor. As it is an emergency situation, I might omit the information. That's not going to be a relevant information in this scenario. About lifestyle, smoking, alcohol, non-smoker, wine, exercise, walks, dog, definitely not. Diet, ongoing counseling regarding diet management to maintain balanced diet. I'll see how to include that information. I mightn't include any social information there because it is an emergency situation and the emergency doctor is going to read this letter. Then the medication, Kinopil oral 40 mg, metformin, glucoside. These are the important information for the reader. So I'm definitely going to include that information there. Now I move to patient's Green Valley Hospital treatment record. That was on 23rd August and today is 30th August. So when I see that date, we need to think backwards to understand how long away it was, the admission was and things. So today is 30th August. That information is very important. Actually, we are going to put that date on the top of the letter. Okay. Now 23rd August means that's a week ago maybe. What happened a week ago? Something happened on that day and she was hospitalized. So I'm going to go through that case note. Patient visiting sister for weekend. Sister lives 3 hours away. Patient admitted to Green Valley Hospital. I will include that information with the fever, sharp pleuritic chest pain. So that's going to be important information there. On breathing, channel weakness, malaise, bradycardia. So these are the admission history of the patient even though it was a week ago. Just check, that's 2019 again. Okay, so I'm going to include that information to give the background history for this doctor. Then on the next day, what happened? That's 24th August. Her vital signs were all kind of 29, 170, 106. It's elevated, but it was a week ago, so I'm not going to include that readings. But it was a week ago. Those readings has no importance anymore. And did full blood examination, erythrocyte sedimentation, increased CRP, increased WCC. It was all a week ago. And throat swab, oral inflammation. That's an important information. That was her diagnosis. Chest X-ray normal, echocardiogram pericarditis. So these are the diagnoses. So I definitely need to include that information. Her chest X-ray was normal, so I might or might not include that information in the letter according to the situation. Then management was IV saline and ibuprofen. I might include that information. I mightn't include the dose because it's all over. But I need to tell the doctor that she was treated with this and this. Then evaluation, viral influenza type B plus pericarditis. That was the diagnosis. Then 25th August she was discharged and advised on self-care at home. Okay, niece drove patient home and agreed to stay overnight for 3 nights. That's over, so I'm not going to include that. Follow-up nurse home visit arranged for 30th August. So that's our date today, and this is the visit we are doing for this patient. Okay, now I move to today's history. That's what I'm seeing for this patient. I'm the nurse. When I say you are the nurse visiting the patient, when we see that first line, just visualize that I'm visiting this patient. I see this patient today and this is today. So just visualize the patient and I'm visiting that patient at home. Observation, she is unhappy. Reports feeling chest pain relieved by sitting up, shortness of breath, frustrated with the progress of recovery. It says she is frustrated, but that emergency consultant doesn't have anything to do with that. I might include that, but I'm going to include the symptoms there. medication adherence, reports compliance, regular blood glucose monitoring. She was fine with everything. BP 125/78, usual 140/90. So there is something wrong. Her usual BP is 140/90, but today it is 125/78. Even though we know that it is a normal reading, the case note says that she is usually 140/90, but today it is 125/78. So I'm going to definitely to include that information in my letter. Needs no longer staying overnight, work amendments, that doesn't matter to the consultant in emergency department. I'm not going to include that information. Assessment, patient unwell, no improvement. Query, relapse or complication of pericarditis. That's what I assume when I say this patient's symptoms. It may be I read that she had viral influenza and pericarditis here a week ago. Now I know she has the same symptoms, and so I doubt it is a relapse or complication of pericarditis, and it is a query. It is not a definitive diagnosis. As a nurse, I'm not able to, or I'm not going to make the proper diagnosis of her condition, but I assume that she is having the relapse of the same condition. So I feel like it is very important to transfer or refer her to the emergency department right now, and that's why that's what I'm going to do. And the plan is organize urgent hospital transfer to Newtown Hospital, write referral to emergency department, include relevant medication, patient history and test results or observation. So we don't need to think much about the relevant information because they clearly give that these are the things to be included in the letter. So it is clearly given. We need to include the medications, we need to include patient's history, and we need to include some test results or observation. So now I know that these are the things I am going to include the letter. So with this reading I have finished my selection of relevant case note. After the there are 3 steps. I think I forgot to mention that there are 3 steps of writing. Whenever we see a case note, there are 3 steps of writing. The first step is selection of relevant case note. Yes, the second step is organization of this case note into sentence, or transformation of this case note into sentences. Before that we need to organize in some way. So selection, organization and transformation, these are the 3 steps we need to follow whenever we write a letter. So my first step is done. I selected the relevant information. Now I think about the organization of the letter. As it is an urgent letter, it says an urgent letter here and in the writing task. So whenever they say it is an urgent letter, I'm sure that I'm going to include patient's present condition or today's condition as my first paragraph. Okay, I'm not going to think about the introduction right now. I'll think about the introduction when I write the letter. So just think about the organization. The first paragraph is going to be patient's present situation. Okay, in the next paragraph I need to include those relevant medical history, because that is the secondary issue that happened a week ago. That's why she is here today in this condition. So that is the background of this main issue, and I am going to include that information as my second paragraph. Then I will move to the request paragraph. Now I know that I am going to I know how to organize the letter. So this is the way the letter looks like, and I'm going to explain each part of the letter. Okay, so now I have all the relevant data, and I have the organization in my mind. Now I am going to transform the case notes into complete sentences. When we transform the case note, be careful that it has to be clear and concise. It has to be concise and it has to be clear. Sometimes when we concise history or the case note, it may lose the clarity, so be careful there. So this is the first part of the letter and we are all familiar with this first part. It is all given in the case note, and it is Miss Patricia's child, date of birth, everything is written. Even the day address is first, then the date. It can be the other way around, both are right. You may write the date first, then the address, that's also going to be right. Again, dear doctor and reference line, we can change the position of these things as well. You may write reference line first and then dear doctor, but try to be consistent when you practice your letter. Try not to write in different ways every day. If you decide to follow one way, try to follow the same every day, and on the exam day try not to make any experiment on the exam day. That's the only thing about it. Okay, now I move to the introduction. I didn't think about introduction at any part of my letter reading. Now I'm okay, it's not reading. Now I'm going to think about the introduction. Okay, so the introduction is thank you for seeing Miss Childs, comma, a 62-year-old widow and retired school teacher, comma, who requires your investigation of a possible relapse of pericarditis. Okay, so this is the best introduction for this letter. We know it is a referral letter, and there is the word transfer as well in the case note. Okay, and we know that even though we know that it's a transfer letter, this is another way of introducing the patient in a referral letter. Okay, so thank you for seeing Miss Childs means I'm writing to refer. It gives the same meaning, but when you go through the sample letters that are provided in OET official website, there are about 60 sample letters for all 12 professions. When you go through those letters, you can see that 60-70% of those letters are started in this way. Okay, they start their letter in a way of anticipatory thank you, anticipatory thanking situation. That's a style of native speakers. They usually write letters in this way. It's a kind of anticipatory thanking. They know that their reader is going to see the patient, or they are going to accept the patient. So they just say thank you for seeing Mr. X or Mrs. X. This is the best way of writing when you write a referral letter, or you may write I'm writing to refer, that's also fine. Okay, so here thank you for seeing Miss Childs. Recently OET recommends to introduce or include patient's full name in the intro paragraph. That's a recent recommendation. This letter was written before that, that's why the full name is not there. So you may write thank you for saying Miss Patricia Childs, comma, a 62-year-old widow and retired school teacher. Okay, so when I think about the social history, she is a widow, she is retired, she has no one at home to look after her, and I need to include or just mention that situation to my reader, but I am not going to make a full paragraph for that. I'm not going to make a social history paragraph for that. If that's the case, in such situation you may include that important piece of information as an additional information like this. The thing is, the format has to be right. You need to practice this format and you can write it well on the exam day. Be careful that it has to be preceded by an article, and that it should be hyphenated, and you can't put an S there. If you say 62 years, it's going to be wrong. Then it has to be followed by some adjectives like that, or nouns, widow and retired school teacher. So the format has to be like that. All these three parts to be all these three parts should be there to complete that sentence. So 1, 2, 3, an article, then hyphenated, age is hyphenated followed by a noun, then only this additional information format is going to be right. So you need to practice, and it is a better way of writing. It is bit more advanced than we write every day. So try to include such a sentence in your letter whenever you get a chance. Then, who requires your investigation of a possible relapse of pericarditis? So that is my purpose. It is included in the letter, and that is the diagnosis. Why did I say possible relapse of pericarditis? We saw in the case note that there is a query there in the last part. There is a query relapse or complication of pericarditis. So when we transform that query into a sentence, this is one way of expanding that query into full sentence. A possible relapse of pericarditis. I know there is a complication there, so I might include that part in the request sentence. So this is a perfect, although it is very short, it is very concise, it is very clear, and it has the it has all the important things needed there in the intro, like diagnosis, purpose, patient's name, and things like that. So this is the perfect introduction for this letter. Now I move to the first paragraph. So first paragraph means after the introduction we write the main issue of the patient. So this patient's today's condition is she has hypertension, diabetes type. That's not the second paragraph actually. I'm sorry. Okay, so I think I missed that first paragraph in that slides. So the first paragraph is going to be, you can write down the first paragraph. I think I forgot that slide to include. So the first paragraph has to be today's history for the today's history or today's condition of the patient. So the sentence is, today Miss Childs reports chest pain, comma, relieved by sitting up, shortness of breath and fatigue. Actually that's there in the full letter. This is the first paragraph in our letter. Today Miss Childs reports chest pain, relieved by sitting up, shortness of breath and fatigue. Okay, she has a low grade fever, in bracket the range is there, tachypnea and tachycardia. Her blood pressure is 125/78, comma, lower than her usual 140/90. So that is her present situation. And if you see that sentence again, you can see that it's written in a present tense because it is today's history, and in this situation we can write today's history in present tense or in past tense. But in this condition I am with the patient and I see these things or these readings in the patient, so I can write it in the present tense. But if it was done in the morning or if it was done a few hours ago or something like that, even though it is today, you may write it in the past tense, but try to be consistent when you write today's history. It can be present or past, try to be consistent. If we start the sentence with the present tense, try to do the present 10 sentences in that first paragraph. If you start with a past tense sentence, try to write all past tense sentences in the first paragraph. Here these are the complaints of the patient: chest pain, shortness of breath, fatigue. She has low grade fever. You may include the reading in the brackets like this, or sometimes OET recommends not to doesn't encourage the overuse of brackets. So if you put one bracket in a sentence, that's fine, but they doesn't encourage the overuse of brackets. Instead you may write just a comma there if you are happy or feel that's the right way. This is also fine. Tachypnea and tachycardia. Her blood pressure is, so again present tense, 125/70 is lower than her usual 140/90. So this is the important information for the reader. So this is my main issue. Now I move to the second paragraph, and that is going to be the secondary issue for this patient, and where I included the last admission history of this patient. Miss Childs became unwell on 23rd August while visiting her sister in Green Valley. Just if you look at that sentence, it is a nice complex sentence. Miss Childs became unwell on 23rd August while visiting her sister in Green Valley, because she is going to a different hospital today. The previous admission was in a different hospital. That's why just mention the name there again. She was admitted to Green Valley Hospital with a fever, pleuritic chest pain, tachycardia and general malaise. That was the complaints she had at that time. Throat swab investigations confirmed viral influenza type A, and an echocardiogram indicated pericarditis. That was the diagnosis, and these are the investigations done to confirm that diagnosis. So in the writing task or just above the writing task, we can see that include test results or observations. Okay, so we need to include those test results in the letter. These are the investigations done for her, and this is the way we need to transform that case note into sentences. Her chest X-ray was normal, and Miss Childs was managed with the IV saline and ibuprofen. So these were the management given for the patient at that time. But if you notice there, I didn't include the dosage or anything of this medication. I just mentioned the name of the medicine because that doctor doesn't want to know the dose and things like that, because it is over. It is all over, so I don't want to include the dose or any detailed information. Same like the readings on that day. There were lots of readings like BP, temperature and things like that, but I don't want to include that information, or I don't need to tell that information to this doctor because he has nothing to do with those issues. So I just mentioned the name of the medicines. She was discharged home on 25th August, and there is a date like that. A nurse home visit was arranged for today. So that today, we have included that today as the first paragraph. Okay, so it is important to include that information as well. Then only that story is going to have a flow. It has to be clear for the reader. If we didn't include that information, the story is not going to be clear for the reader. So try to include that as sentence as well in our letter. So if you note the way they wrote it like that, a nurse home visit was arranged for today. A nurse home visit. That's a nice way of writing. We see lots of case notes like that, and sometimes we don't know how to transform that case note into a nice full sentences. Sometimes we see like twice weekly home visits were arranged for her. A nurse home visit was arranged for her. That's a nice way, way of forming sentences. So just try to learn such sentences, and you can copy it on the exam day. If you can't make such nice sentences on your own, try to learn nice sentences when you see it, and try to copy it as it is when you see such case notes again in your on the exam day. Also, it is nicely concised, and the story is clear for the reader by throwing this paragraph. Now when I think about her past medical history, I feel like it is important to tell the reader that she has been taking some regular medication for her ongoing illness, and it is an important piece of information, but I can't include it in the main issue. That's not the main issue, and I don't feel comfortable to include that information in the second paragraph, because that deals with another issue, that's hospital admission history of this patient. So I can't include that information in that paragraph as well. So I'm going to write that information in a separate paragraph. That's why we always recommend, if you feel to make a third paragraph, that's fine, there's no problem with that, but try not to mix up the information in the paragraphs. That's not a nice way of writing in English. One paragraph should deal with one issue. So when we think like that, we need to make a separate paragraph for this history. And here I said Miss Child has hypertension, diabetes type 2 and depression, comma, managed with the quinopril 40 mg twice daily. I expanded that by 2 to twice daily. Metformin 500 mg twice a day and glycoside 30 mg daily. Actually I copied that information from the case note, because one name is a chemical name and the other name is a brand name. In official OET exam case notes, the medicines are given this way in these days. So try to copy the medicines as it is. If you try to change the letters or words into capital letter or small letter, it's going to be wrong, because for the first medicine, this quinapril, we need to write the lowercase q there. If it is an acupril, it has to be capitalized A. So we might not be sure about which is the brand name, which is the capital name. So one safe way is to copy it as it is. Please do not make any changes with the medications and copy it as it is, then you will be safe. Okay. Again, Miss Childs has hypertension, diabetes and depression. In the case note, we saw that in the past medical history, it is like hypertension diagnosed in some year, diabetes diagnosed in 1 year, and depression was diagnosed in some year, and there is some more history about all those past medical history. But here in the letter I didn't include any of those years or times for the letter, because it is my reader is a doctor in the emergency department, so he doesn't want to know how long she has been taking this medication for. He just wants to know what is she taking and what's her condition. So she just wants to, or he just wants to know that information. If I write this same letter to an endocrinologist, endocrinologist usually deals with the hormonal problems. If I am writing this letter to an endocrinologist for detailed assessment or further management of her diabetes and things like that, I might need to include that information as well. In that situation, I need to write Mrs. Childs has had diabetes since 2008, which is managed with this and this. But it all depends on the reader. So when you see such case notes in the in our letter, it is going to be the same in every letters. But when you transform that case note into sentences, it all depends on the reader. It is your responsibility to transform such case note in a perfect way for the reader. So I hope it's clear now. As it is a doctor in emergency, as it is an emergency situation and the reader is a doctor, I didn't include the year or time of the disease, but I detailed these medications there, because that's what he wants to know. If it is a different reader, the sentence formation is also going to be different. So that is her past medical history. Now I move to my request paragraph. When you see this request paragraph, we might be a bit confused, because the sentence is, I suspect a relapse of pericarditis, perhaps with complications. I refer her to you for urgent assessment and management. There I used I there and I there, but we usually don't encourage students to use that I, we and things like that in the letter, because we are not the main subject of the letter. It is our patient, it is their treatment. They are the main issues in a letter. That's why we discourage you to use these words. But in this situation, in this particular scenario, I am the boss here because I am visiting this patient and I suspect that she is having some complications and I decide to refer this patient to the doctor. Usually it's not us decide about the referral. We may be carrying out an order when a doctor see the patient. That is the normal scenario or the usual scenario, but in this particular situation it is us making the decision. We are the boss and we are referring the patient. Only in such situations you can write it in there. There is nothing like you can't write this way. You can, but it's only in a particular situation, and it is very rare in OET letter. So this is a perfect request for this paragraph. I refer her to you for urgent assessment and management. I suspect a relapse of pericarditis, perhaps with the complication. I didn't mention that complication in the intros. I mentioned that here in this paragraph. Okay, then yours faithfully, because I write dear doctor there and nurse, whatever letter it is, you may write like a nurse there. You don't need to write registered nurse, community health. It is not necessary. You can write nurse if it is if you are a nurse and writing this letter. Okay, so if you are not comfortable to write this request paragraph and it is not recommended for every case note, you can write it in a normal way as you write always. So another way of writing this request is, Miss Childs is being referred to you for an urgent assessment and management. Her symptoms are suggestive of pericarditis, perhaps with the complications. If you didn't include that information in the intro, you can write it in the request paragraph in this way. Okay, Miss Childs is being referred to you for an urgent assessment and management. Her symptoms are suggestive of pericarditis, perhaps with the complication. Or you can include the second sentence in the intro paragraph. Then you can write the sentence, only one sentence in the request paragraph. So you have your freedom to when you write your request paragraph and intro paragraph. It's up to you, and try to personalize each and every letter in a way that is suitable for the situation and the reader. Okay, so I hope this letter is clear. If you have any doubts to ask, you can ask me in the comment box. Okay, so it is very important to remember some points when you write an urgent letter. Try to include the today's history or the present situation in the first paragraph. That is the main thing to remember. I know we sometimes think like it won't make sense for the reader, but this letter makes perfect sense for the reader. That means you can write in this way as well. You can write the supporting history in the second paragraph. That's what OET recommend. So I'm going through some questions. If there is no name for the receiver, what can I able to use? Dear doctor or sir, madam, what can we be able to use? That's Bindu asked that question. If there is no name for the receiver, here we don't have any name for the receiver. Even though there is no name, there will be definitely a designation for the reader. So if there is a designation for the reader, try to write that as the first line of the address paragraph. if you are confused, if it is something like manager, director or something like that, and if you are confused how to address that reader, you may write sir or madam, but it is not a way of native speakers. So you better, that is the last choice. The first choice is always the name, and the second choice goes to the designation. So if there is no name, you can write the designation. If you are confused and you can't pick up a right way to address the reader, you may, as a last choice, you may use dear sir or madam. Okay. Now there is another question, can we use thank you for accepting? That's Aparna. It is okay to use thank you for accepting, but what I recommend is use the word accepting when it is a transfer letter. For example, if we are transferring this patient to an institution, if it is an institutional transfer, they are going to receive our patient or accept our patient into their institution. In such situation, it is better to use thank you for accepting. If it is just a referral letter and if the patient is going to be seen by the reader, then the better way is thank you for seeing. Okay, there are lots of questions are coming through. I'll try to answer a few now. Is it necessary to write the dosage of own medications? You skip the dosage of medication he had taken in the hospitals. I explained that there when I gave the explanation. I'll do that again because it is not necessary, because that ibuprofen medicine is a temporary medication and it is for only 2 to 3 days and it is for pain, and the reader doesn't have to do anything with it. Okay, so the medicine is over and the reader just wants to know that what she got in hospital. He doesn't care about the dosage of those medication. If it is necessary to carry out the purpose or the care that we request, then we need to include the information. If the information doesn't help the reader to carry out the purpose, we don't need to include that information. I hope it's clear. Thank you, Aparna, for that question. If any punctuation mark need before written drug dosages, there are different ways that we can write drug dosages. We may write paracetamol, 500 mg thrice daily, semicolon, and things like that. You may, that's also right, but this form is also right. When we write 2-3 medications, there's no point putting commas in between everywhere, so you may write in this way, and this is also a perfect way of writing. Okay, then Soumya asking how many days can we use in one paragraph? There is no such a rule in OET. It depends on the way you organize the letter. When we think about a paragraph, if we give 2, 3, 4 dates in a paragraph, that doesn't make any sense to the reader. He is going to be confused. So if the information has to be clear for the reader, if we need some dates, 1 date or 2 dates, we can include that dates, but not more than 2 dates in a paragraph, or not more than 2 or 3 dates in a full letter. Again, when I said about this, there is one more thing. Students usually ask how many connectives we can use in a letter. Some students think like they have to use 3-4 connectives in a letter to score high in OET letter. If you go through this letter, there is no connectives except one simple while connective in one sentence. Okay, so that's the only connective or complex connective used in this letter, and that letter makes sense to the reader and it is very clear and concise. So I'm going to score high for this letter even without any complex connectives. I used one there are some more complex compound connectives, but I used only one complex connective in one sentence, and there is a misconception that you are going to score high if you use 3-4 connectives. We get students from different institutions and they say that, oh, we were told to use 3, 4, 5 connectives in the letter to score high, but there's nothing like that. OET, the only thing OET recommend is try to concise and convey the message clearly to the reader. That's the only requirement. There is nothing, no rules like punctuation or connectives. There is no strict rules about it. If the story, if you want to make the story more clear to the reader, and if you need a connective to make that story clear for the reader, then you can use the connective. Otherwise, just write the letter without the connective. Okay, so I think it's time to wind up. I know there are some more questions. I might try to answer those questions afterwards. I hope the letter was clear, and if it is an urgent letter tomorrow, I'm sure that you are going to perform very well. So good luck to all my students and for everyone for your exam today or tomorrow. I know you'll be doing your last minute preparations right now. I wish you get an urgent or emergency letter tomorrow so you can perform well. As I always say, നിങ്ങൾ വിചാരിക്കുവാണ് എനിക്ക് നേടാൻ പറ്റും, എനിക്ക് പറ്റും, എസ് ഐ ക്യാൻ എന്ന് വിചാരിക്കുകയാണെങ്കിൽ നമുക്ക് നേടാൻ പറ്റാത്ത ഒരു കാര്യമില്ല. ആ ഒരു ആറ്റിറ്റ്യൂഡാണ് നമ്മൾ റെഡിയാക്കി എടുക്കേണ്ടത്. അപ്പോൾ നമുക്ക് അങ്ങനെ ആ ഒരു ആറ്റിറ്റ്യൂഡിലാണ് നമ്മൾ എക്സാം നാളെ എഴുതാൻ പോകുന്നതെങ്കിൽ നിങ്ങളെല്ലാവരും പാസ്സാവും. നമ്മുടെ IELTSൻ്റെ റിസൾട്ടൊക്കെ ഇപ്പോൾ വന്നുകൊണ്ടിരിക്കുവാണ്. ഇന്ന് നല്ലൊരു ഹ്യൂജ് റിസൾട്ടാണ് വന്നുകൊണ്ടിരിക്കുന്നത് ആസ് ഓൾവേസ്. അതുപോലെ തന്നെ നമ്മുടെ OETയുടെയും congrats to the students who passed the exam last time. നല്ലൊരു റിസൾട്ട് ആയിരുന്നു നമുക്ക്. ഇനിയും അതുപോലെയുള്ള റിസൾട്ട് നെക്സ്റ്റ് വീക്ക് റിസൾട്ട് വരും. അതുപോലെയുള്ള ഹ്യൂജ് റിസൾട്ടുകളാണ് നമ്മൾ എക്സ്പെക്ട് ചെയ്യണത്. അപ്പോൾ നാളെ എക്സാം എഴുതാൻ പോണ എല്ലാവർക്കും ഓൾ ദി ബെസ്റ്റ്. ബി കാം, ദാറ്റ് ഈസ് ദ ഇമ്പോർട്ടൻറ്റ് തിങ്. നിങ്ങൾ നാളെ പേടിച്ച് ടെൻഷൻ അടിച്ച് പോയിട്ട് പ്രത്യേകിച്ചൊന്നും നേടാനില്ല. ബി കാം ഓൺ ദ എക്സാം ഡേ. ബി പോസിറ്റീവ്. ആ ഒരു ആറ്റിറ്റ്യൂഡ് ഉണ്ടെങ്കിൽ നമുക്ക് ജീവിതത്തിൽ നേടാനാവാത്ത ഒന്നുമില്ല. Then the most important thing is be confident. നമ്മുടെ എഫേർട്ട് നമ്മൾ എടുത്തു. We were practicing very hard so we can perform well on the exam day. Be confident. So you all will pass your exam tomorrow. Thank you and all the best.